Welcome, everybody. Welcome, welcome. Welcome to the Senior Living 411 series. November is Fall Prevention Month. And for the entire month of November, we here at the Senior Living 411 series will be speaking to several industry experts on various aspects of fall prevention. To kick off the series today, we've brought you one of the best. Please join me in welcoming Lorna King-Bobb to our show. Lorna will be discussing the 411 on internal factors that may lead to falls. But first, let me tell you a little bit about Lorna. Lorna possesses over 40 years of experience in the healthcare industry. She's also a very dedicated, hardworking nurse and professor. She's a certified worldwide leader in healthcare with the International Nurses Association and is honored for her exceptional success in the nursing community. Lorna's many years in the nursing industry demonstrates the passion, dedication, and enthusiasm for patient care that is necessary to earn her the title of top nurse in her field. Lorna sees nursing as her oxygen. She has worked as a professor in nursing at Seneca College, York University, and Centennial Bachelor of Science Bridging Nursing Program. She also works as a clinical educator at George Brown College and in the surgical program at Trillium Health Partners. She's passionate about educating others on how to live a healthy lifestyle to prevent illness and diseases. Lorna is a registered nurse with a Bachelor of Nursing degree from New Brunswick and Masters of Arts and Masters of Education from Central Michigan University. She's also the Director of Care and Education with one of our leading home health care companies. Lorna, welcome.
Thank you. Hello, my name is Lorna and I'll be talking on fall prevention. First, I must give you the dictionary definition of what's a fall. A fall is defined as an event which results in the person coming to rest inadvertently on the ground or other lower level, thus sustaining a violent blow, loss of consciousness, sudden onset of paralysis, or an epileptic seizure. That's what the dictionary says a fall is. I would add, or death. Some falls do lead to instant death, as you might know. Fall prevention. Fall prevention is not or may not seem like a lively topic. However, it's a very important topic with the population I'm dealing with, seniors population. As we grow older, physical changes and health conditions and the very medications used to treat those conditions can make falls more prevalent. Falls are the leading cause of injury among our dear seniors. 63% of falls occur in the seniors population. My focus tonight, as Desiree says, will be on the internal health factors that lead to falls in our seniors. That's the aggregate I'm dealing with. So what are some of the causes of falls, you may ask? As we grow older, our balance and mobility become compromised due to a variety of reasons. Example, certain medications like your blood pressure pills, chemotherapy. These can cause lightheadedness and you fall. A lack of lower body strength for a fractured hip or a fractured ankle, altered sensory or motor function in the case of a Parkinson's disease patient, where he has that tremor in his upper extremities and that shuffling gait when he walks. A low hemoglobin, anemia it's called. You get up and you're dizzy, boom, you fall to the floor. Also, or a combination of these variables can contribute to a fall. The psychological and functional consequences of falls in our seniors can be very severe. A fall leads to great fear in our seniors, great anxiety. Even when they're doing normal activities, that fear exists, and to them, that fear is very, very real. Falls in our seniors have become the leading cause of isolation, injury, death, and serious hospitalization, sometimes for months. But our seniors need to be physically active and not at risk. It is said that many falls in a senior's experience can lead to a post-fall syndrome. That would lead the seniors to a nursing home. Why? Because she loses her independence. She becomes very depressed and isolated. She becomes very inactive, so her muscles atrophy, which predisposes her to even more falls. Falls also affects how the caregiver and family members care for this fearful senior. She becomes more rigid. She avoids gathering. She is less active. She walks with fear. And therefore, all of this contributes to her losing her independence and fall. Therefore, she ends up in a nursing home. Other intrinsic causes of falls are decreased bone and muscle strength, as in osteoporosis, poor balance or gait problems, reduced vision like macular degeneration, reduced hearing, medical issues like impaired mobility, chronic obstructive pulmonary disease, neuropathy, neurological diseases, diabetes, osteoarthritis, osteoporosis, just to name a few. A big one is malnutrition. Poor dietary intake can lead to falls. Chronic foot problems, chronic back problems, depression and pain. These could be debilitating diseases that can lead to falls. It was Dr. Louis Lipset, a professor of medicine at Harvard Medical School, who said, falls kill. Falls kill. Couldn't be more precise. Falls are a recognized marker of frailty and mobility impairment in our seniors. I repeat, falls are a recognized marker of frailty and mobility impairment in our seniors. It is said that our seniors between 74 and 85 years of age, who require help with their activity of daily living, and seniors with a limitation in walking, transfer, and balance issues are at a higher rate of falling. Other intrinsic factors are age, gender, women, of course, and they fall and sustain fractures. Alcohol consumption, living alone, greater functional activity. A big one, very large one, is medications. There is a group of drugs called benzodiazepine, like Valium, Ativan, Xanax, Restoril, Imovane, to name a few. These drugs used in older people is associated with falls and fractures. Also diuretics, like Lasix. It deprives them of the electrolytes, like potassium, causes them to be weak, frail, and they fall. Sedations, get up in the morning or even going to the bathroom during the night, and they can fall. So because of chronic disease management, the number of prescribed medication has increased the risk of falls among our seniors. And some of those drugs I mentioned, our seniors are taking it. That's why they're hospitalized so frequently. Another big one is impaired mobility and gait. Decline in muscle strength, muscle power, causing a decline in your activity of daily living, where one is unable to prevent a slip, a trip, or stumble from becoming a fall. So we see that muscle weakness is a significant risk factor for falls, as is gait deficit, balance deficit, and the use of an assistive device like a walker. Difficulty rising from a chair is also associated with falls. The sedentary life. Less activity causes muscle atrophy. Joints become stiff from inability. I must stress that nutritional deficiency causing a low body mass index can also lead to falls. In my research, I read where vitamin B12 and vitamin D, especially a deficiency in these two vitamins can cause abnormal gait and muscle weakness, as well as osteoporosis. Impaired cognition is also highly associated with falls in seniors. That's in the Alzheimer's disease area. Visual impairment, like in diabetes, where they've got cataracts, glaucoma, macular degeneration, all contribute to fall risk. Multifocal glasses, it impair your depth perception, especially when you're negotiating the stairs. So our seniors have to be careful there. Foot problems, ankle problems like bunions, toe deformity, ulcers, deformed nails, and general pain in walking can increase balance difficulty and risk of falls. Footwear is also important. It must be comfortable and supportive. So what are some of the extrinsic risk factors of falls? They're mainly environmental, like slipping and tripping, especially on the ice or on carpets, linoleum, lack of good balance, environmental hazards like poor lighting in the bedroom or down the stairs, slippery floors, uneven surfaces, etc. Improper footwear and long clothing that get caught in your feet. Inappropriate walking aids or assistive devices like walkers, cane and roll aiders, they should fit to suit. Clutter in the home. Inadequate lighting, especially down the stairs. Insecure toilet seats. Hard to reach personal items. Low toilet seats. Unstable wheels, especially in the wheelchair. And I threw this in. Lock any moving objects or device before you as a senior or anyone gets into it. So how can we prevent falls that's causing so much havoc? A big one is exercise. As a daily routine, just 15 minutes. Some weights in your hands and on your feet. Tai Chi is a good martial art exercise that can help you accomplish this. 2, education. and home modification should be a priority. Home assessment and intervention, health screening of at-risk older seniors, home-based exercises for seniors with history of falls, sparing use of psychotropic medication. These are drugs that affect your moods, your behaviors. Examples: Haldol, Mellaril, Seroquel, sleeping pills, Valium, Ativan, to name a few. You should have your eyes checked annually. As I said with bifocals, just be careful walking with them. Proper healthy nutritious diet, very necessary. Proper footwear, walkers and canes should measure to suit. We take walking for granted as a society. But if you didn't take anything away from this, I want you to remember, when one takes a footstep, just a footstep, this usually depends on proper functioning of the various body functions at play, like the sensory, neuromuscular, and skeletal systems, your tactile input, your visual input, your vestibular input in maintaining the body's center of gravity within its base of support. If these sensory pathways are age compromised or diseased, a fall can and will occur. It then begs the question, we all will like to live longer in our homes, but that does not mean we're safe. When last have you done an assessment on the house you have been living in for the last 15 to 20 years or more? What about that carpet you keep tripping and falling over? How safe are you in your home? Have you assessed and made changes to your home as you age? Or are you living in the same home when you were 15 years old? Think about these things and the hazards that are there waiting to happen, to put you in a place that you never want to go at this age in your life. Thank you.
Thank you, Lorna. A lot of information I was typing into the chat just so people can keep up with it and see what's there. I was also jotting down questions as you were speaking as well that I'm going to go back and forth with you. And if anyone who's watching has any questions, please feel free to put it into the chat and we'll try our best to answer your questions. My first one that really struck me, you mentioned that women were at a higher risk of falling. Why is that?
A lot of us women have UTI problems, also running to the bathroom. But statistics shows, according to the statistics, it shows that women, don't forget we have children, so our body, the erosion on our body predisposes us to this. So the statistics shows that women have more of these deficits that predisposes them to falls, like high blood pressure, prolapsed uterus, UTIs that cause them to be running to the bathroom. Blood circulation in their feet is so impeded that the lack of the circulation causes them to be in pain and walk with cane and so forth. So all these contribute to that.
Very interesting. Wow, good to know. So I've had a few people ask me about these too. These machines that we see that are these round blood circulation machines where you sit and they massage feet. Are those types of things really helpful in helping the circulation?
I think it's temporary helpful, yes, to stimulate the circulation to get it going. But if your circulation is impeding because of atherosclerosis, this is hardening of the arteries in the diabetic patient, it won't change anything. It's just temporary relief because the arteries are narrowed. So the circulation is impeded already because the valves and the circulation is so small, that the vessels are so small. The
Mhm.
circulation is impeded.
Okay. I have a question from Deborah Clerk. She wanted to know if you can list out some medications that can affect people, I guess, increase their risk of falling.
So all those benzotropine that I alluded to, like the Seroquel, the Ativan, the Xanax, the Valium, all these sedative medication, benzotropine and hypertrophic medication can cause that. Even be careful with the over-the-counter sedation to sleep, can
Mm.
contribute to falls.
Oh, wow. Okay. You also mentioned that B12 and vitamin D were good for us to take to help with staying away from the risk. What is the recommended daily intake of vitamin B12?
Well, for me, I take 1 tablet of vitamin B12 complex daily.
Okay.
Everybody is different, so let me not say that, but what for me, I
Mhm.
take 1 B12 complex because of the folic acid and other things in there daily. But everybody has different comorbidities and different requirements as per their health.
Okay. All right. Can you named several diseases and conditions that may contribute to a fall. What would you say are the top five most chronic that would make the risk extremely high?
Well, Alzheimer's disease, because of the different aspect, because in Alzheimer's disease, you have the loss of judgment, the loss of ability, impair cognition. So because it's a brain death or neurodegenerative disorder, it affects your dopamine production. So what happens? Because it doesn't regenerate itself, it causes, and because it dies and there's no cure, it leads to some of the symptoms. For example, in Parkinson's, where they have that shuffling gait and that tremor in the hand, the balance is off. So they're
Mhm.
falling. Someone who does not, can't, the judgment is off. So they go outside in the cold. That's environmental, without a shoe.
Mhm.
So there's so many things that they can do because of Alzheimer's. They can cause trauma to themselves and falls. One
Mhm.
of the other ones is diabetes. Insulin, your insulin might be, your diet might not be enough carbohydrate to absorb the insulin, to produce the insulin, and that might cause you to get dizzy and fall. And the circulation in their feet is impeded as well because of the atherosclerosis, and that's why they can step on a nail. They can even fall, bruise themselves, and do not know. You also have arthritis. Osteoporosis is one of them. In osteoporosis, this is quite a debilitating disease. It means porous bones. Because their bones are brittle and less dense, this can lead to broken bones and pain, which causes disability. So the pain could be debilitating, that causes them to fall. And sometimes it's a fall that causes the X-ray, when they have the X-ray, to be aware that they have a fracture. So that's it as well. And you have bowel and bladder incontinence, running to the bathroom all the time. They can slip on their urine and fall. Run into the bathroom at night. In that hustle, they can fall. And COPD, bronchitis, where it's not reversible, but the depletion of oxygen affects your brain function, and you can fall because you can lose your balance.
Wow. And this is one of the reasons why we stress the importance of appropriate lighting in the home.
Right.
Because if you said if someone's shoving and running to the bathroom, they don't want to be flicking for a light. So that's why it's good to have a sensor activated light. So as they walk in, the light turns on. Lorna, what type of footwear? I did a home safety assessment the other day. What type of footwear do you recommend for a senior living in a home with hardwood flooring?
I have a chiropractor, and my chiropractor work along with my chiropodist, because I am on my feet 12 hours sometimes in the hospital setting on the hard stone floor. I can actually feel the pain in my feet. So I do not want to tell anybody what they should, but I know what they put together, because there's a lot of padding in my shoe in order, and after 1 year, I've got to change it because it's so eroded. So it depends upon what they're doing and what they're using the shoe for. Whether it's for running, whether it's for walking around in the building or whatever, it varies.
Okay. And someone with osteoarthritis, does walking worsen that?
Well, they need to move. Don't forget, sometimes with osteoporosis, they do not know they have osteoporosis. Sometimes it's a fall and an X-ray reveal they've had several fractures. And then when they do further investigation, they do have osteoporosis. But somebody with osteoporosis, you need to be mobile. But it's not walking long distances. You can do quality walk, short distances.
Okay, so quality walks, short distances.
Because your muscle atrophy if you're not moving. And that predisposes you to fall. So they need to be replaced with the calcium that they're using. And this is where the doctor works with them throughout all of this.
Okay. And Lorna, what do you do if your loved one has fallen? How do you support them?
Okay, when one has a fall, our spontaneous instinct is to go and get them up. But you need to think first. You do not know if she has a fracture, whether it's cervical or hip or whatever. So what I advise my nurses to do, get a pillow, or if you've got a jacket on, put it under her head, keep her warm and comfortable, and call 911. Because you do not want to ajar her neck if the cervical bones are broken, if she sustained a head injury. So you don't want to make things worse. So just make her warm and comfortable, put a jacket on her head, stay with her, and call 911.
Okay, so don't move them because you don't know, you said,
exactly.
What? Okay. I have a question from Avril. How can one tell if they have osteoporosis?
So sometimes osteoporosis, it's called porous bones or porous imagery. What happened? We do not know when we have osteoporosis, because according to my readings, they discovered this later on in the 35 thereabout, and it's from a fall. So this can lead to broken bones, can cause pain on a hole. Pain on a hole when you walk, pain on a hole when you move. Your doctor should be more aware of what you're saying and do x-ray. They can do skeletal x-ray where they do the x-rays of all your bones and see what's going on. And they can see that your bones are porous and treat you appropriately. But sometimes these doctors are not as astute, and they need to be, some of them.
Can osteoporosis...
And sometimes it's a fall that lets them know you've got osteoporosis.
Is osteoporosis reversible?
No.
Okay. Lorna, do you have any closing words, last advice for our viewers on these internal factors that may lead to falls?
One of the things I always think of, like COVID is good and it's bad. I think we all are part of the hustle and bustle, but our diet should be a reflection of who we are, because you are what you eat. Food is medicine. Food makes you better or makes you worse. Food gives you health. It's a drug. Excess, though, causes problems. A balanced diet is very necessary. Exercise is very necessary. One should always be challenging their brain cells so that they do not lose their gray matter or get Alzheimer's. You do not have to have Alzheimer's in your family to get Alzheimer's. It is so rampant. 10.6 billion people have Alzheimer's. But looking at that TV is wasting time sometimes. Take a book and read. Do Scrabble. Anything that would stimulate your thought process. Even a good conversation, current issues. So keep healthy. Take deep breaths. Exercise, educate yourself.
Well, Lorna, thank you. It's always a pleasure. The first time you came on my show, it was back in 2018. It's been a pleasure having you back again. And I want to thank you so much for joining us. I also want to invite all of our viewers to join me tomorrow, Tuesday, November the 2nd at 7 p.m. for the 411 on fall prevention myths and solutions. A lot of this Lorna has covered, but we're going to go over it more comprehensively. And this exclusive seminar is designed specifically for any senior or older adult, anyone who has fallen, who has fear of falling, anyone who knows someone who has fallen, anyone who wants to age in place, which means staying put at home, and any caregiver for someone who has fallen or has a fear of falling. As an expert specializing in providing high-quality fall prevention services to seniors in Ontario, I will introduce you to the 10 most common myths and the realities about adult falls. You will gain valuable insights and strategies helping you and your family to communicate more effectively and dispel the myths associated with falls. To view our entire calendar of events, go to seniorliving411.com and click on events. I'd like to thank you once again for joining us, to Lorna and to all of our viewers who joined us this evening, and have a very blessed week. Thank you very much.